Institute, where the focus is on inspiring massage education and wellness for the body, mind, and spirit. My name is Ariana Vincent, and I'm the founder of the Ariana Institute. I'm a nationally approved massage therapy instructor and continuing education provider. I've been an instructor for 14 years, and I've been a massage therapist for 32 years. The Ariana Institute is dedicated to providing expert instruction in therapeutic massage and bodywork. This sports massage continuing education course fulfills 6 hours of continuing education credit for licensed massage therapists. This online sports massage course offers a history of sports massage, description of sports massage techniques, information related to the benefits of sports massage, contraindications for sports massage, and practice building and marketing tips. Types of sports massage techniques that can be utilized. Acupressure, which is melting or holding. Acupressure is non-intrusive, and it concerns the stimulation of the same pattern of meridians as addressed in acupuncture. These meridians are stimulated through gentle touch across the various meridians throughout the body in order to unblock and restore physical and mental health and balance to the human body. So I'll demonstrate an acupressure technique. So for example, there's a meridian that runs up the inside of the leg, and we could offer acupressure. Just another way to offer acupressure is to follow the line of the meridian. Instead of pressing and holding, we can press and pulse. 1 pulse per second for 10 to 30 seconds. And so acupressure is one technique that you can utilize in sports massage. Compression massage. Rhythmic compression into muscles used to create a deep hyperemia and softening effect in the tissues. It's generally used as a warm-up for deeper, more specific massage work. I'll demonstrate compression. So I'm leaning into the musculature. Most of the pressure is on the palm of my hands, but I'm also contacting the skin with the tips of my fingers. This is really good for cyclists, for example. Compress, compress, compress. After cyclists have completed a long race like the MS 150, it's really good to compress from the bottom of the leg, working gently over the knee up to the very top. The next technique is cross-fiber massage. Friction techniques applied in a general manner to create a stretching and broadening effect in large muscle groups or on site-specific muscle and connective tissue. Deep transverse friction applied to reduce adhesions and help create strong, flexible repair during the healing process. And so an example of a cross-fiber technique would be in the upper part of the leg, and the cross-fiber would be just like this, where you're moving your thumbs across the band of muscles. And then slowly move up the length of the muscle. And you can also, of course, use cross-fiber technique in other parts of the body. The next technique is cryotherapy. Cryotherapy is the local or general use of low temperatures in somatic therapy, or the removal of heat from a body part. The term cryotherapy comes from the Greek cryo, meaning cold, and the word therapy, meaning cure. Its goal is to decrease cellular metabolism, increase cellular survival, decrease inflammation, decrease pain and spasm, and promote vasoconstriction. So an example of cryotherapy would be utilizing a cold pack, the ultimate cold pack, and then just place that cold pack on the leg. And then eventually the cold pack will permeate through the layer of fabric. You can even put fabric on top, and that'll help hold the cold in. So that's cryotherapy. Our next technique is deep Swedish massage. Muscle-specific applications of the standard effleurage. I'll demonstrate effleurage. It's a long flowing stroke. Petrissage, which would be shorter strokes. This is a rotating thumb petrissage. Vibration. Kneading. Fulling. Stripping. And tapotement. Techniques. Our next technique is facilitative active stretching, also known as active isolated stretching. Facilitative active stretching is a method of muscle lengthening and fascial release that is a type of athletic stretching. This technique provides effective, dynamic, facilitative stretching of major muscle groups, and it provides functional and physiological restoration of superficial and deep fascial planes. So one example of active isolated stretching would be for me to take the knee and move it toward the chest, and then the knee across the body, and then the knee to the shoulder. And the client is holding the sheet together with her hand. So now we're going to go knee to chest. And then knee across the body. And then knee to shoulder. And then back down. And that's facilitative active stretching. Our next technique is hydrotherapy. Hydrotherapy involves a range of methods and techniques, many of which use water as a medium to facilitate thermoregulatory reactions for therapeutic benefit. The appliances and arrangements by means of which heat and cold are brought to bear are A. Packings, hot and cold, general and local, sweating and cooling. B. Hot air and steam baths. C. General baths of hot and cold water. D. Sitz baths, which the client is sitting. Spinal, head, and foot baths. E. Bandages or compresses, wet and dry. And also fomentations and poultices, hot and cold, rubbings and water potations, hot and cold. And lastly, you could use hot stones, or you could use cold stones. Or you could intersperse. You could first have the hot stone, and then follow it with a cold stone, so then you have vasoconstriction and vasodilation. The vasodilation would come with the hot stone, and the vasoconstriction would come with the cold stone. The next technique is joint mobilization, which is range of motion. Joint mobilization is done when a bone or an individual vertebra is moved in order to release painful tension, stiffness, chronic pain, and in some cases to improve the range of motion of a joint. And so what we would do for joint mobilization would be to place one hand under the heel, one hand on the toes, and just mobilize the joint. So right now we're focusing on the ankle, moving first in a clockwise direction and then in a counterclockwise direction, and then flexing and extending, dorsiflexion and plantar flexion. So that's one example of joint mobilization. Our next technique is lymphatic massage. Lymphatic massage involves the stimulation of specialized lymphatic drainage pathways, which improves the body's removal of edemas and effusion. So for lymphatic massage, you would work toward the inguinal area, which is right here, or if you were working in the top of the body, you would work toward the axillary nodes. The middle of the body, you'd work toward the inguinals this way. Lymphatic massage is a very light movement. It's like a leaf on the water with just 5 grams of pressure. That's an example of lymphatic massage. The next technique we'll describe is trigger point massage. Combined positioning and specific finger or thumb pressure into a trigger or tender points in muscle and connective tissue to reduce hypersensitivity, muscle spasms, and referred pain patterns that characterize the point. Left untreated, such trigger or tender points often lead to restrictions and painful movement of entire body regions. And so an example of trigger point therapy might be above the knee or in the area where the knee connects. So there may be a trigger point right in this area, for example, and you can just press and manipulate the trigger point. You can also do the same thing with your fingers. And that helps relieve tension and tightness in that area. Another technique we can use in sports massage is aromatherapy. We could utilize eucalyptus. I've diluted it with a little bit of oil, rubbing my hands together, and then you can hold it over the client's face. You can also apply it to the musculature. There are a wide variety of aromatherapy products that you can utilize to help reduce muscular tension and tightness. Another aromatherapy product would be wintergreen. You only need 2 or 3 drops, and then you could apply wintergreen to the feet. It's very cooling and soothing. So if you just run a race, for example, this would be a very nice aromatherapy product to use. In addition to aromatherapy, you can use products that are specifically designed to be pain relieving. And this would be an example. It's BioFreeze, and you could just spray the BioFreeze on the affected area. And that's very cooling and soothing also. So those are some additional techniques that you can utilize in your sports massage practice. Sports massage describes the physiological effects of exertion on the body and builds upon the base of how massage can help the short-term negative effects. This sports massage course emphasizes the fact that athletes use their bodies to accomplish amazing feats, and massage therapy can help them do these amazing things with greater ease and less pain. A helpful list of resources is provided in the course notebook that will enhance your knowledge and build on what you have learned in this course. There's also beneficial information in the course notebook related to practice building and marketing your sports massage therapy practice. Nationally approved course credits are accepted throughout the United States for licensed massage therapists. Your certificate of completion is available for downloading immediately upon completion of the course. Register for your massage therapy CE courses today at www.arianainstitute.com or contact me at Ariana@arianainstitute.com. Thank you for watching.